Pyometra in dogs is a potentially fatal condition that's all too common in entire females. It is one of the big reasons why vets generally recommend all females should be spayed. For those unfortunate dogs that develop Pyometra, emergency, life-saving surgery is the best option to ensure a full recovery. Stick around to learn more. Hi, I'm Dr. Alex Avery from ourpetshealth.com, helping you and your pet to live a healthier, happier life. Pyometra is an infection of the uterus of entire female dogs, which typically develops around middle age or later. Now, when we think of an infection, we will generally imagine that antibiotics are the main way we treat and cure it. It's not so simple in this case. In a dog with Pyometra, the uterus essentially becomes like a giant pus-filled balloon, and there is no way that the antibiotic can even control the infection, let alone cure it. It's a bit more complicated than that. But first, let's go back to the beginning. While older individuals are at a much higher risk of developing Pyometra, it can happen in young animals too who have not been spayed. In fact, this is one of the major reasons for spaying in the first place, with intact females having around a 20 to 25% chance of developing this condition by the time they reach 10 years of old. Now, this is a 1 in 4 chance. There are reported differences between breeds, and in some breeds having a litter of pups may offer some protection, but for all entire female dogs there is a real risk of developing Pyometra. And although the risk increases with age, young individuals can also be affected occasionally too. Hormonal treatment given to prevent seasons or hormones given after accidental mating to prevent pregnancy are also thought to increase the risk of a female dog developing Pyometra. The death rate of Pyometra is about 5% with treatment, and without treatment, death should be considered as an almost certainty. So the typical Pyometra occurs within 2 months of a season, and there are a number of things that you might notice in your dog. They're generally pretty vague, but they can include lethargy, inappetence, weakness, vomiting, diarrhea, an increased thirst, increased urination, and potentially also an enlarged abdomen. The clearest sign of a Pyometra is the presence of pus draining out to the vagina. Your dogs may keep themselves clean though, and this discharge may not be obvious. When this takes place, it is known as an open Pyometra because the open cervix allows this drainage. If the cervix is closed though, this discharge won't be seen and a closed Pyometra develops. In this instance, there is nowhere for the pus to drain, and so the patient often becomes unwell faster and is worse affected at the time of diagnosis. Any unwell entire female dog should be considered to have a Pyometra until proven otherwise. But how then will your vet diagnose this condition? Well, a blood test is often taken to check on general body health, and this will give them some clues. X-rays can be useful and can give a diagnosis if the uterus is very enlarged. When a Pyometra is small though, or just starting, X-rays are not very sensitive, and so a Pyometra can be missed, and a blood test can similarly miss the condition. X-rays also can't distinguish early pregnancy from infection, and this is because the bones of a developing puppy only show up a couple of weeks before birth. Ultrasound then is the best method of diagnosis. It can pick up the condition at an earlier stage and can easily distinguish between Pyometra and pregnancy. Ultrasound is also risk-free and quick when it is available. Once a diagnosis is made, quick treatment is needed to reduce the risk of the uterus bursting as well as other serious toxic complications from taking place. In all patients, antibiotics will be started. A decision then needs to be made: surgery or medical treatment. For any dog not wanting to be bred in the future, a complete ovariohysterectomy is the treatment of choice because it not only cures the condition, but it also prevents it from happening again. Depending on the condition of the patient, stabilisation with intravenous fluids and medication may be needed before going to surgery, and it must be mentioned that any anaesthetic or surgery carries a risk to the patient, especially one who is older and unwell. Despite this though, in the majority of patients, surgical treatment is by far the best choice, and the vast majority will recover really well after a short hospitalisation. For patients who want to be bred later, then there is the option of medical treatment. For those who are severely unwell though, surgical removal of the uterus may in fact be safer. This is because all the toxins and inflammatory substances will be quickly removed and not able to continue damaging the body. It typically takes 2 to 4 days for medical treatment to result in an improvement of the patient. Also, for those with a closed Pyometra, there is an increased risk of the uterus bursting, which can be catastrophic. For those where drug treatment is desirable, then there are several different protocols which will depend on your vet's own experience as well as the drugs that are available at the time. The reason for this is that not all drugs are stocked by everyone, especially if your vet doesn't have a big breeding client base. The big drawbacks of medical treatment are time taken for an improvement to take place, the risk of treatment failure, and also the significant risk that a Pyometra will recur, with up to 70% of patients having a recurrence of a pyometra within 2 years. Now this means that breeding should take place as soon as possible, and once completed, the patient should ideally be spayed. Of course, prevention is much better than cure. Having a bitch spayed completely removes the risk of a pyometra so long as the ovaries are completely removed. This is because active ovaries are essential for a pyometra to develop. Ovary sparing sterilisation is not common and also does nothing to remove the risk of a pyometra from developing. As for when to spay, well, this is a video for another day. There is a lot of research going on in this area and our standard dogmatic recommendations are being challenged, so watch this space. As a final comment, while pyometra can affect cats, it is in fact very uncommon. So I hope this video answers the questions that you may have had about this common condition. But if you have any other questions or if there are any comments that you'd like to leave, I'd love to read them down in the comments section below. Also, if it's your first time here, consider subscribing to this channel to make sure that you don't miss out on future content and allow me to continue to help you and your pet to live a healthier, happier life. So until next time, I'm Dr. Alex from ourpetshealth.com. The best care for every pet with every condition, every time.